By far, this has been the worst week in Oregon for the coronavirus pandemic. The state reported 1,517 new cases today. That's the fourth straight day Oregon has seen a record high in daily cases. Multnomah County also set another record with 516 cases, the first time any county in Oregon has ever gone over the 500 daily case mark. Clackamas County had the second most with 207. One new death reported today, a 65-year-old man in Multnomah County. The 820th death in the state from the virus so far. It continues a very disturbing and fast-moving trend in Oregon. Since Governor Brown's freeze went into effect Wednesday, over 6,600 new cases have been confirmed. That's nearly the same amount the state saw from the start of the pandemic back in March until June 20th. As this surge continues, a spokesperson from the Oregon Center for Nursing says it is now taking its toll on those who are working grueling shifts to care for all the patients. KOIN 6's Jennifer Dowling has more on its impact on all of those hard-working people out there tonight on the front lines. Jennifer.
Good evening, Wayne. It is a big impact. She says that nurses are exhausted right now and maxing out their schedules and hours, and she has a warning about how this could affect everyone else and their medical care down the road.
We are going to start getting to the point where it's going to be harder and harder to get healthcare professionals, nurses, respiratory therapists, physicians, because that is a very limited resource that you can't just set up a factory and build.
Janet Britton says if things keep going the way they are, the resource of nursing staff will be at a breaking point and there will be less people to care for the sick. She says people can help to stop the spread of COVID-19 by wearing masks around others outside of their own homes, but some people still refuse to assist by doing that.
It's frustrating to them that they are working as hard as they can and have been since the beginning of the pandemic, and yet we're still having this surge, and the surge is exactly the way everyone described that it was going to be back at the beginning of summer. And it's still really difficult. It's very, very difficult for them, basically mentally, and just the absolute stress that's being put on them right now.
She says that most nurses that she's talked to will be sacrificing their own family time over the holidays to care for patients. She says because the entire U.S. is a COVID hotspot right now, there are no traveling backup nurses that can come relieve those who are working overtime here in Oregon. She says all of those folks that could be the cavalry, so to speak, are in their own communities, their own states, trying to deal with COVID outbreaks there. Back to you, Wayne.
Yeah, we need to take care of the people that are here right now doing all that hard work. Thank you, Jennifer.